this a little. Well, good afternoon. My name is Gary Hughes. I'm the chair of the Schenectady County Legislature, and I'd like to welcome you all to this occasion as we gather to celebrate the grand opening of the Hometown Health Dental Clinic right here in Schenectady. All of your presence here today adds to the significance of the event, and we're grateful for the support of all those who have been instrumental in making this project a reality. Among our distinguished guests, we have some of my colleagues from the County Legislature that I'll introduce first. Michelle Osterlich is here, Legislator Osterlich from District 3. And Richard Paterni, our new majority leader, is also here from the city of Schenectady. Congressman Tonko has joined us today. We actually rescheduled this a couple of times so it would fit the congressman's schedule, because without his leadership on the ARPA funding, we wouldn't have anything to celebrate here today. So we thank Congressman Tonko for that. Some colleagues from the City Council are also here. Doreen DeToro and Carmel Patrick have joined us. Ray Gillen, the chair of Metroplex Development Authority, is here. We have Assembly Member Mary Beth Walsh with us today as well. From Hometown Health, we thank the CEO, Joe Gambino, and Rory Ogden, the Director of Dental Surgery and the Chief Dental Officer for Hometown Health. This is an important moment. We stand here to inaugurate the Hometown Health Dental Clinic. This is an endeavor that embodies the resilience and compassion of our community. I'm honored to be here on behalf of my colleagues who saw a critical need for accessible dental service in our community and quickly came together to fill the funding gap that was critical to getting this project moving forward. All of this started in 2021 when Ellis Medicine closed its dental clinic and its dental residency program in Schenectady, leaving more than 9,000 patients without crucial dental care. I think beyond this facility, there is perhaps one dentist in the entire county who will accept Medicaid patients, so this was a huge gap. Hometown Health, true to their commitment to our community as a federally qualified health center, moved swiftly to absorb the patients, but also recognized the pressing need for a modern facility to better serve the growing number of patients. So without their willingness to fill this void, many of these individuals would have no access, including a lot of children, I would add, would have no access to dental care. So when we met with Joe Gambino to discuss the need for expanded access to dental services, and parenthetically, let me stop and say that this discussion started when my predecessor, Tony Jasinski, was a member of the legislature, was chair of the legislature, and has proceeded through to now. Joe was able to explain Hometown Health's plan to address the issue, but there was no doubt in our mind the project would have a major impact on the community and deserved our support. The legislature contributed $4 million of our ARPA funding to this project. My colleagues back here, bridging the financial gap to bring this $7.5 million cutting-edge facility, which we will tour in just a bit, into reality. Today we stand in a 12,500 square foot state-of-the-art clinic, 30 exam rooms, latest digital technology, serving 14,000 patients annually. And even more impressive, Schenectady County is now home to the only Capital Region dental clinic offering oral surgery for Medicaid patients. So, as we like to say whenever we have a chance, working together works, as it did on this project. Beyond the expanded capacity and the comprehensive services, this clinic also serves as a lifeline for dental patients on Medicaid, the uninsured, the underinsured. It really embodies Hometown's mission to serve the health needs of those seeking their care, regardless of their insurance status, and providing that care in a dignified way in a dignified facility. So, We'll continue to work with Hometown Health to ensure residents of Schenectady County have access to the services they need and deserve. We thank you all for being part of this occasion. We should celebrate this clinic as we have for community years. I'd like to welcome our Congressman, Tonko, to the podium. Thank you. Appreciate your leadership. My pleasure.
Well, thank you, Chairman Hughes, and good afternoon, everyone.
Good afternoon.
The progress of this building, the transformation of it, has been something that I've watched with a hawk's eye every time I drive through the neighborhood, which is frequently. And it is so impressive that it's been transformed there, Joseph Gambino, to a wonderful facility that has a soulfulness to it because it's going to reach those most in need and respond to our neighbors and keep them healthy and keep them whole and respect them. And nothing could be better as a goal than to accomplish something like that. And so walking in here, having been in this building many, many times as the former retail center it was, and then through the stages of development here, it just blows you away. It looks phenomenal. And while the building is impressive and the transformation is stellar, it's nothing without the human infrastructure. So to Joseph Gambino and to Dr. Ogden and all of the phenomenal staff, medical staff and support staff, thank you for making this the success story that it is. So let me thank Joe Gambino, who I've known for a long time, and when we had a chance to bring back capital fund projects, community fund projects, CFP, formerly known as earmarks. No one budget at any level, and I'll speak to the federal level, can imagine all of the bumps in the road for the year to come. So I think having a set-aside discretionary pot of 1% of all discretionary funds in the federal budget, just a bit of money from that huge pot, going towards discretionary determination by members of Congress. And so when we heard about the news with the Ellis decision, when we heard about the efforts to grow and expand Hometown Health and to respond in a neighborhood that is a perfect setting for the people that require the services, this was a natural. And we were allowed to have 10 projects. So I say that on the outset. I thank everyone here at Hometown Health, and thank you again, Joe, for all of the partnership in developing the outcome that we recognize and celebrate today. But I'll go through it first by saying this is government at its best, when we all come together and work as a team to accomplish what we need to accomplish. And in this case, providing quality healthcare access in our capital region. This is a phenomenal bit of good news for our neighbors who have easy access to this facility for very critical and important needs. So it is keeping that mission spirit alive within the halls of government to be able to serve the people that we represent. And, you know, I think it happens best when we develop those partnerships and relationships with all levels of government working together from federal over to local and making certain that all are in touch in a bicameral, bipartisan way to deliver on behalf of the people that place their trust in us. And then to hear from the local community about what those needs might be and better yet, what those solutions are to make certain that it works and that we invest in a functional way that has every best chance of providing for success. So today we celebrate that process. Late in 2020 and then moving into early 21, there was talk of resurrecting the earmark process. And then Appropriations Chair Rosa DeLauro was talking about having a guardrail approach to make certain that there were restrictions to what could be asked for. Governments at all levels, public institutions, not-for-profits would be the only eligible. And so we worked with Hometown Health because they qualified. We had to make certain that, we checked through the many applications that we got and we determined which were most likely to meet the test in Washington at the Appropriations Committee level and which would provide the biggest bang for the buck. And so this was a natural fit for one of those 10 projects that each person of Congress was limited to applying for. And so that worked. And then I thought, because I have to defend this application before the Appropriations Committee, the best way to do that is go into the belly of the beast and get to know them up close and personal. Now, I know the track record of this great organization. I know the good work that you do. But to see the nuts and bolts of what was happening here, I mean, we're taking a former drugstore and turning it into a place of hope for people. So we went through and did an up-close and personal visit and tried to figure out with an empty shell what this was going to look like. But talking about the expanded services, the additional staff, the opportunities for more technology being there, again, right in the neighborhood, right at the epicenter of the community that was going to be served. All of that spoke great volumes. So it gave us oomph to go to the Appropriations Committee and adequately defend this request. And so whatever subcommittee of the Appropriation Committee this was assigned, we had to meet with them and with the Appropriations Chair. And we were happy that in 2 years ago, almost, in March of 22, the appropriators put together the final package of these projects that were incorporated into the budget for 22 that incorporated these dollars. And for this district, $14.5 million for projects, the 10 projects in our region. So that's an added plus, an investment that bears lucrative dividends for all the people in this region. And I'm so proud to have been affiliated with this effort to make certain that as we work through all of this, we're working with a tradition and a success story here named Hometown Health that really went its extra mile to provide for those who are marginalized, those who are truly in need. And it just makes you feel good to be able to invest the dollars in that capacity. Now, Chairman Hughes also mentioned, and I have to thank the Schenectady County Legislature. Thank you, Michelle. Thank you, Rich. Thank you, Chairman. And Chairman Jasinski before Chairman Hughes for having that foresight to partner up with their dollars that came from ARPA, the American Rescue Plan Act money. Now, we had done those. It was a very tough vote in the House. I think it might have been totally partisan. But I was proud and will still defend that vote because every level of government, including state and counties and local cities, villages, and the like, were able to receive guaranteed amounts of money to go and do their post-COVID activity. Which projects do you deem locally, which investments are best locally to come back from COVID? And by the way, as an industrialized nation in the entire free world, we had the best comeback as a country from COVID. And I think it was due in large part to ARPA. And so what did this county do with their ARPA money? A number of great things, including investing $4 million in this project. So I feel really bonded to this effort with the $750,000 grant and the $4 million ARPA funds to Schenectady County that enabled them to partner up in another capacity with this project. So let me wish everyone well. I can't wait to tell the appropriators back home that they made a community, a county very proud and very significantly responsible and responsive to a group of individuals called Neighbors and Friends who need this facility. And to all those, again, that are going to provide that excellent care, that healing touch, that caring heart, thank you for who you are, what you do, and thank you to the entire Hometown Health family. Good luck with your project.
You're okay. I just need to find my thing here. So at this point, I'd like to invite Joe Gambino, the CEO of Hometown Health, to the podium. Joe. You need it?
No, I'm good.
You're good.
The congressman just asked me if I was the Rite Aid manager. Which I thought that was pretty good. You know, I do notice a trend, though. Every time it seems that I speak, I always follow the congressman, which is not an easy thing to do. He's very good at it, but thank you very much for the kind words. Today is a very happy day for me personally. I've been at Hometown a long time, and to see this project come together the way that it did, makes me very happy. The mission at Hometown, to say it briefly, is to care for people who may not have the funds that are necessary or the access that is necessary to get to the doctors or dentists that they need. What you see here is not just a roughly $8 million beautiful building that's right in the heart of Schenectady. What you're seeing is a fulfillment of a mission. Because today, we doubled the capacity of our dental facility. But not only that, we have 14,000 patients. We have a waiting list of 5,000 people who are waiting to get dental care. And with this building, it's a step forward to make sure that we can take care of those individuals and hopefully bring healthier outcomes in the process, which is what this is all about. And as far as I'm concerned, that is an amazing success story. You do not do this alone. To listen to everyone say my name, and I appreciate it, Chairman, I appreciate it, Congressman, and everyone else, but this is completely a team effort. No one knows Tim Starr. I'm telling you right now, there are a few people in this building that do. No one knows Tim Starr, but I can tell you this building doesn't happen without Tim Starr. And if he's here, please pop your head up. There he is. First and foremost, too, I want to thank our board of directors because it was, and Dr. Ogden reminded me, it was roughly 3 years ago that I went to the board and said, we have a problem. There is going to be significantly less access to services in this community. And matter of fact, it was you, Kathy. I can hear you say it. We have a moral obligation to do this. Those were your exact words. And sure enough, the board of directors who are here today, most of them are standing over here. I think I see Kiva in the back too. Said yes, we have to do this, and that was not an easy thing to do because it's a very expensive project. It's something that we had to do from the ground up. But I want to thank them personally for seeing the vision of this effort because it's going to help a whole lot of people. So thank you very much. I'd also like to thank Bob Careau. Bob runs the Schenectady Foundation. I don't think Hometown has ever done a project that the Schenectady Foundation didn't see value in and supported. So on behalf of not only myself but the health center, Bob, I want to thank you and the distribution committee and everyone else for helping everything that we do. I don't have to tell you what a great friend the congressman is to Hometown Health. When he says he's been here a number of times, he has. He was in this building when there was nothing here, and so was Michelle. I think Rich was here.
When we were breaking
When we were breaking, yeah. I mean, they've been here since the very beginning. There were 10 projects that the congressman could fund, and he chose Hometown Health Center. I will never be able to thank him for that. So thank you very much for all of it. It's a blessing. And what can I say about the county? The Commissioner Hughes said they talked to me about the project. I don't know how to say. I was sitting at a table with all the county legislators. Chris Gardner was there, and I'm getting hit with all this, and I didn't know what was happening. It was sort of this inquisition. Don't get me wrong, in a very friendly way. And then they come back with a $4 million investment in this project. I mean, thank you, Schenectady County. But I would also like to say, and I hope you feel the same way, that you can proudly now talk about the largest modern dental facility in the entire capital region, and it sits right here in Schenectady. Finally, but definitely not because I'm saying this finally, I want to introduce you to the heroes who really deserve this day. It's my dental team over here, including Rory Ogden. They are amazing. I can't even tell you the work that they do on a daily basis. It's phenomenal. They see the most difficult cases. They take care of people who have so many problems in their lives, and they bring healthier outcomes to this community, which not only is benefiting the patient, but it's also benefiting taxpayers in this entire community because we're keeping people out of the ER, which is what we're hoping to do more of in the future. So thank you, Hometown Health Dentist staff. And with that, I think probably the best way to bring this all together is to, and I hope I'm not stepping on your toes here, but introduce Dr. Rory Ogden. Dr. Ogden came to us as a dental resident. She worked with us for a year. Seems like maybe even a little longer than that, but she definitely worked with us for a year. We were fortunate to hire her, and she excelled in the position. She's excelled as a leader. She runs an amazing dental department, and this project also would not be what it is today without the time and effort that Dr. Ogden put in. So please, everyone, help me welcome Dr. Rory Ogden.
Thank you. Those were very kind words. I just want to say hi and welcome to our new home to everyone. Exactly 3 years ago, we went to our board to ask for approval for this expansion project, and they said yes without hesitation. They understood the great need in our community after a large dental clinic closed in the area. And since that decision, another large dental clinic has also closed in this area. It's taking on more burden to us. Imagine you break a front tooth by falling or playing with your kids. You don't have a regular dentist. You call up for an appointment. You are told there are 5,000 people ahead of you. Please wait. There are no other offices in this area who take your insurance. So now you go on months without smiling confidently, waiting to be seen. That is the dire need and situation that many people in our community and surrounding communities are in. While we cannot be the sole solution to this desperate issue, this new clinic will help accommodate more patients and hopefully start decreasing the wait time for timely dental care. I also want to thank everyone who's been thanked. I think I could talk for weeks and it wouldn't be enough to show the gratitude that we have that you all made this possible. The design of our clinic is top of the line, which includes digital impressions, 3D scans, and implants, just to name a few things. The design of our new oral surgery suite with the recovery room will allow our OS team to accommodate more patients. We are extremely lucky to have Dr. Wadwa, who's over here, who is one of the best surgeons in the state, and he is the only oral surgeon that accepts all insurances. So I encourage any specialist who want to do more, please contact me. I have a home for you here. Finally, I'm going to keep it brief. I would just want to conclude by acknowledging and thanking all of our providers and staff here who serve our community. They are the true shining stars in this, and it could not be done without them. So thank you.
I think we're moving toward our ribbon cutting, but I wanted to say one thing that is kind of an improvisation, but I have been on the legislature for 20 years. Along the path of that, I've also been about 30 years working in healthcare, specifically in health insurance. And let me tell you, federally chartered health clinics, health centers like Hometown Health, Congressman, please do everything you can to keep these facilities open because they are absolutely critical to the population that needs them the most. There's one in Albany. We need these facilities. They are very, very important to our health status. And you guys did not talk too long. People need to hear this story. It's very, very important.
All right, we are.
Somebody counting?
1, 2, 3.
Great.